Tonight on the newsfeed late night. Do you believe that the actions, I suppose, pronounced by the president today will do enough to firstly discourage people from continuing to spread the virus in their behavior, but to do enough to inspire people to actually want to change and deal with the virus?
I think there's a lot of communication that's required to get a sort of a proper behavioral response, because once we get to the point where we've reduced transmission using the current restrictions, we face the possibility of a return to normal behavior and a further resurgence, particularly going into winter. So I think the messaging definitely has to improve. And the problem now is large parts of the South African community don't really believe the government message anymore, and there's a loss of trust overall. And it's an issue about how to rebuild trust in what government is doing.
Now, of course, one would have thought coming into this address, the president understands the weight of the pandemic on the country, with over 1 million infections and well over 30,000 lives that have been lost already. Do you believe that within the party, Prof, they've got the kind of correct action steps to take as far as you mentioned, the communication, but not only the communication, but also in behavior of the leadership of the ANC itself?
Yeah, so the responsibility for driving the COVID strategy is very much government's responsibility. And the question is really, what's the role of the ruling party, the governing party itself, in the way government performs? And it's quite clear that there is a lot of interference in the way government performs from the way the party performs itself. And that is a real problem. We have not necessarily seen a well-organized response to large parts of the pandemic, and in particular to the vaccine rollout, which is clearly way behind schedule and is going to put us at severe risk when we now go into a potential third surge as we move into sort of April, May.
Is there real alignment between what the president is saying the party wants to do and what's happening in state as far as social support is concerned? The president is saying we will continue to strengthen our social support in as far as the vulnerable and economic support to businesses and workers in distress. We have seen some kind of support, especially in the first wave of the pandemic, but around this particular second wave, how is the state performing compared to the language that we're hearing from the party?
In essence, I don't think that they can promise more than they're currently doing, because the level 5 lockdown impacted so dramatically on government's finances that their ability to provide additional social support through various channels has been severely limited. And that also limits the extent to which they can introduce lockdown measures that have economic implications, because it has so many knock-on effects that government can't mitigate. That they've got to be very careful in the balance between the economy and managing the epidemic. So I don't see much change in the social support from what we have now. They've tried to limit the interventions to limit the extent to which they need to provide it.
They're talking about still preparing to implement a mass vaccination program. What are your reflections on the appropriate quantities that we actually do need in the country to procure to be able to effectively deal with COVID-19?
Yeah, so according to my estimates, we'd need about 84 million doses if we wanted to reach herd immunity. And the cost impact of that is quite limited overall, although it would cost between sort of 7.1 and 15 billion rand. That's actually quite reasonable for us as an expense, and a large part of that, many parts of the private sector have been prepared to fund, and medical schemes will also be prepared to fund. But the problem has really been the operational side of the overall plan, because government has basically chosen to be the sole procurer of the vaccines, and then it has procured virtually none. And that is a real constraint. And they've also not introduced a coherent rollout program. In other words, how are you actually going to get the vaccines into people? And so the question there is, how are we going to mobilize the private sector, which will be key to the first phase, because all frontline health workers, all health workers are on medical schemes, which means it's a private sector delivery framework. So how is that going to work? And then we've got to roll out to the rest of the country. And how is that going to work when we're trying to do about 200 or so thousand vaccinations a day or more the longer we wait?
I thought I'd bring in here the president of Cosatu, Zingiswa Losi, joining us on the line. Good evening, Mam Losi, and thank you very much for your time. What do you make of the pronouncement by the president today, particularly around the commitment in managing the country's economy and public finances in a sustainable manner?
Good evening, Thabo, and good evening to the viewers and listeners. Look, as the Federation, we want to welcome the January 8th message of the ANC, but in relation to the issues of the economy, we think that the statement does not express the reality of the pain workers are experiencing. For an example, with the collapse of the state, the public services, your SOEs and municipalities. And also we feel that it does not acknowledge that workers are losing jobs in collapsing SOEs. And when the president spoke about, for example, acknowledging the support that the ANC has for Cosatu, with the Treasury putting the austerity measures and collapsing the collective bargaining, we don't see it as that support, because Cosatu stands for the interests and the livelihoods of workers in this country, who are not just workers but members of society and community members. So we think that it led the plan for us to really believe that indeed it is in the interest of the workers and the public at large, because of the austerity measures that the National Treasury continues to put the country under.
Yeah. Are you satisfied with the degree and the level of the procuring of vaccines, particularly for the scores of your members who are frontline workers?
We welcome the announcement of the procurement of the vaccine, but of course, we are waiting for the actual plan. You see, that is why Cosatu released a statement earlier on and said, we are very, very disappointed, because what we were promised was that in the first quarter, they will start to roll out the vaccine. But then the announcement that was made by the minister, which he then went back on his word when he said it will be on the second quarter. When we raised our frustration, he went back and said they did not mean that. They mean it will be on the first quarter. What we are waiting for is for the actual rollout of the plan. But we are worried because it seems as if the leaders are grappling straws without necessarily saying this is the plan. Because we knew about this, we signed contracts with companies that are manufacturing these before even they could start manufacturing them. But for us to be still talking about what could be done instead of saying what is it that we have planned to do and this is how the rollout is going to look like, South Africans are panicking. The numbers are rising, and frontline workers continue to die at work on duty. They continue to be infected, and we think that before we even get to the reopening of the schools, we really need to have a clear rollout plan.
I'd stay with us, President of Cosatu, Zingiswa Losi, as well as Professor Alex van der Heever when we continue next.
It's difficult to say what needs to happen because the source of this misinformation needs to be attacked systematically. It is utter nonsense, and it does represent a severe threat to the only prevention approaches that will work in South Africa. The people who don't get vaccinated at the end of the day are going to just get infected if we don't have herd immunity. So and that places the risk of dying. You're basically playing roulette with your life. And what you want to do is to make sure that people do not make huge mistakes of information they're getting off the internet and social media, in which they're not verifying the underlying information and the science. But I do think that it means very careful messaging and building up of trust, because that kind of conspiracy theory is a consequence of a loss of trust in many mainstream areas of information supply. And I think we need to build that very, very carefully.
So when you hear the president talking about, in fact, it wasn't the president, but it was actually Nomvula Mokonyane in an earlier briefing the media out of that statement, saying that the myth busting of some of these theories around COVID-19 should actually stay out of the political realm and actually be left to the experts. What do you say?
Well, I missed that. But from what you are raising, if I get you correctly, look, until for me, as Prof said, until the South African government and those that are responsible for educating South Africans and putting things into perspective are taking leadership, people will continue to be confused, because remember, people are panicking. People are losing loved ones, and theories are being spread all over. And until the leadership of this country stands up, those scientists, those ones that have knowledge, to say, but this is a myth, and this is the reason why it is a myth. I think the challenge that we have is that things continue to go haywire. You know, rumors are being spread, and no one who has that authority comes forward and try using the very same media platform to put the correct information. And one simple thing that I want to raise, Butabo, is the example of the WHO. There's a clip that was playing of the WHO official who was talking about the vaccine, seemingly by interpretation of our people, is that the second strain is being manufactured here in South Africa. It's like it's being created to be the way it is. And we lack to hear leadership coming forward and saying, but this is not what they mean, and this is what they mean, or this is not correct, and this is the correct information. And it continues to gain momentum until people believed what is incorrect, because the correct information is not coming to counter what is being spread. So until leaders take leadership and be where the masses are and feed the correct information, we are going to continue to have these challenges, and people will continue to reject what they are scared of and what they do not understand.
But shouldn't the ANC and its alliance partners be taking that responsibility of mobilizing its own leaders to take forward the correct information?
Well, it is not just the responsibility of the ANC alone or the alliance alone. It is the responsibility of all of us. Because remember, we are all in this together. And I think if we are going to leave it, because others will perpetuate this information on the basis of political expediency. But I think it is the responsibility of all of us, those that are in the medical field, to come up and say, but this is just a myth, it does not exist, and these are factual points around these matters. For as long as that is not happening, alliance partners can come out. We are not doctors, some of us, so we will speak on the politics of things, but you need the scientists, you need the people that understand the field itself to come up and say, if you are talking about people that are going to deal with the 5G theory, they need to say there could be negative effects about if it is what the impact of the radiation that the 5G will cause, but it's got nothing to do with COVID. And point out what are those issues, just like the 4G, the 3G, and others would have had. And so you can't say people are wrong for having fears, but you need leaders that are going to say, but this is the correct information. And the ANC alone or the alliance alone would not be on their own be able to deal with these matters. I think these are societal matters, and we need to depoliticize them. We need to depoliticize them and let no one to score political point on these matters, but understand that as a country, we need to come together to deal with the crisis that the country is facing.
All right, before we let you go, let's talk about the restoration of the economy and the creation of jobs. From the statement today, the president of the ANC pronouncing that there is consensus at NEDLEC about what steps need to be taken for the recovery of the economy. Are you part of that consensus and that social compact?
Yes, Cosatu as a federation and 3 other federations, we are participating at NEDLEC, as you would know. And on the day-to-day basis, we are participating in negotiating and finding those consensus. It is not an easy way, because what we have understood and appreciated, Thabo, is that we all need to play a role in building this country, in building the economy. And the finding those consensus becomes important. We're not going to win everything, but we need to understand that it's going to take all of us to rebuild our economy. We're all victims of this, but we really need to stop pointing fingers and say, how are we going to dirty our hands in putting the blocks, cement and everything together in rebuilding this economy for the future of our own and the future of the next generation.
I mean, let me quote here what he says, is at the heart of the plan is mobilizing investment. And there seems to be a different understanding, I suppose, with the alliance partners, and you'll help me here, about particularly that, what it takes to encourage that investment.
Of course, that's why I said that we would have some differences. Look, mobilizing investment and encouraging investment, we always say that it cannot also be at the expense of the people of this country, because you're not going to build an economy in the absence of people participating in that economy. So if you are going to build an economy, you need to have people that are active in the economy. But as they are active, it does not necessarily mean that they are active just for them to be able to go and build products at the firm and go home on an empty stomach. So we need to try and strike that balance. And all what we're saying as a federation and federations then, workers in this country, is that when we are ensuring that investors are coming in, it must also not be at the expense of the standard of living of the people of this country, particularly those that wake up to build the very same economy.
Prof, final words from your side as far as the measures to curb the spread of the virus and the economy.
I think it's. I think essentially there's a discussion now about how we do rebuild the economy that is going to be separate from addressing the virus. To a large extent, the measures are only going to go as far as targeting the gatherings and areas of super spreading and minimize the impact of the economy. We've still got sectors of the economy that are incredibly hard hit and kind of need to be protected.
Right.
I think that
Prof,
we've
I'm
got
going to have to leave it.
out.
I'm going to have to leave it there, unfortunately, because of time. But I do appreciate both of you, President of Cosatu, Zingiswa, Losi, and Professor Alex van der Heever. The news.